Today we are here to present our poster on the topic Management of Panfacial Fracture. Panfacial fracture is a multiple fracture of the facial bones that affects mainly the upper, middle and lower third of the face. The major cause is the physical assault, head-on collision, fall from height, gunshot and the blast injury. One of the primary concern with regards to repair the injury is airway management. The airway management can be done by the four mechanisms like the oral intubation, nasal intubation, tracheostomy, and the submental intubation. Once the airway has been established, a sequence steps has to be followed in order to repair the injury, which can be done either by the bottom up or the inside out approach or the top to down or the outside in approach. In bottom up method, the first major step is to re-establish the maxillomandibular unit.
Coming to the bottom up technique, the first fracture to be repaired is the palate. So this can be done using two techniques. One is the open mucosa and the closed mucosa. In the open mucosa, a plate is placed over the fracture site, and in the closed mucosa, transmucosal screws can be used. And coming to mandible, characteristic parasymphysial and angle fracture along with comminuted condylar segments and loss of spatial relationship between the mandible and the skull bone usually occurs. So this can be treated using the maxillomandibular fixation to restore the occlusion. And coming to the intercondylar fracture, usually a closed treatment protocol can be used for the functional restoration. But in subcondylar and condylar neck fractures, an open approach using endoscopic or retromandibular repair can be done.
Of the palate and no mandibular fracture, the re-establishment of the maxillomandibular unit can be done using the arch bar and the MMF. In case of the mandibular fracture, the arch configuration can be obtained using MMF. If there is a LIFO-type fracture, a sagittal split of the palate and no mandibular fracture, the mandibular dental arch can be used as a guide to establish the occlusion and width of the maxillar dental arch with placement of arch bar and MMF.
Now coming to the top-down technique or the outside-in technique. So this technique involves starting with the reduction and fixation at the level of the calvarium, and this is proceeded in the caudal direction with the reduction and fixation, that is top to down. Then position, the zygomatic arch and the infraorbital rim is taken into consideration during the reduction. The naso-orbital, ethmoidal and the nasal fracture is then addressed, and so finally the orbital wall, the orbital floor is reconstructed. And then they go to the maxillomandibular fixation where the mandibular fracture and the condylar fractures can be treated.
Conclusion. Sequencing is often combined with either bottom to top or top